The Delta variant of COVID-19 certainly taking hold across the country. It is here in Bexar County, and just around the corner is back to school. So a lot of questions having to do with kids and vaccinations, masking in school. So to talk about that, we have Dr. Tess Barton, pediatric infectious disease specialist with UT Health San Antonio, with us today.
Dr. Barton, thank you for joining us. There are a lot of nervous parents and, a couple right here on this set. And there are people that email us wondering what's the best thing as a parent to do when there are conflicting recommendations on whether you need to mask up. There's certainly not going to be a mandate that comes because the state of Texas the governor's basically said that's not going to happen. So how uneasy are you about when we see these rising COVID numbers and there are just a large group of children that can't get vaccinated as we head into school time?
I think this is a pretty concerning scenario where you do have increasing cases at the beginning of a surge with a variant that appears to be more contagious and actually more serious, causing more severe disease than what we had last year. The masking in schools, I think, the masking generally has been recommended for unvaccinated people who are indoors. So, the American Academy of Pediatrics has just recommended that that children who are going to be unvaccinated should be wearing masks when they are in the school building.
And you agree with that?
I do agree with that. Last school year was a little bit different. We had, reduced numbers of kids in school, and we didn't have a lot of school transmission, which was encouraging, but that's largely because we were doing the protective measures in school. I think if you put unvaccinated or not immune people indoors in a room with their faces uncovered, you're going to see transmission. And I think that will be a scenario to see more infected children than what we've been used to seeing.
And in the past, when we've seen COVID infections in kids, thankfully, so many of those cases in children have been mild. A lot of them have recovered very well. But what about the Delta variant? Have you seen that show up in kids, or what are you seeing when it comes to infections in children right now?
So I don't have specific information on whether the children that I've been seeing with COVID specifically have the Delta variant or not, although we know that it's the most common strain that's going around right now. What I know is that we're seeing kids who are getting hospitalized. So we're seeing kids who are sick.
I don't know that that's getting out enough. I mean, you're talking about school-age children who are too young to be vaccinated who are being hospitalized.
Yes.
Interesting.
And these are children that are typically otherwise healthy?
There have been otherwise healthy kids as well as special needs kids. So, it runs the gamut. So, in general, children still seem to be less severely affected overall than adults do. And that's still encouraging. But we know that now that the proportion of infections that we're seeing, it's higher among children than it used to be. And that's partly because they're not protected. We have to remember that they're still vulnerable.
Right. Absolutely. Is there any hope that the vaccines that we have right now will be cleared for kids younger than they are right now?
Yes. So the anticipated timeline of when we're going to get that information submitted to the FDA, when we expect to have that happen, has been pushed into the fall and the winter. My guess is that I believe that they're likely looking a little bit more closely for myocarditis issues in the younger children.
Talk about myocarditis. What is it and how is it showing up? How prevalent is it?
So myocarditis is inflammation of the heart, and it can be in different parts of the heart. We usually think of myocarditis as the heart muscle becoming inflamed, and it's actually a known complication of COVID itself. I don't know if there was this Big Ten study where they looked at athletes in the Big Ten, and 2% of the ones who got COVID developed myocarditis. So now we've seen that as a rare but potentially serious side effect of one of the vaccines in boys in particular. Although I have to say that mathematically, the chance of having myocarditis from the vaccine is actually lower than your chance of having myocarditis from COVID.
I know we've had you on the Q&A before, and it was eye-opening to me when you said myocarditis is something that could come from a common cold in some cases, viruses that we are all very familiar with. Before we wrap up here, just your advice, and I got to say I'm asking this on a personal note, for parents who have kids younger than 12 who are not eligible to be vaccinated, whether they're in school, at the grocery store, wherever they are, what's your advice to protect those children right now?
So my advice is, first of all, anybody in the household who can get vaccinated should, because that creates a little bit of a cocoon bubble around the child. And secondly, when a child is going to be indoors around other people that are unmasked and might be also not vaccinated, that they should be wearing a mask.
Could somebody that's been vaccinated still be a carrier?
Yes. So the vaccine is highly protective against severe disease. It's less protective against mild disease, and it's a little bit less protective against getting infected and then potentially spreading. It still is quite good, but it doesn't necessarily keep you from getting infected and passing it on.
I wish we had more time. We've got more questions, so I apologize in advance for any follow-up emails that you may be getting from me. Dr. Tess Barton, pediatric infectious disease specialist, thanks so much for being here today.
Thank you for having me.
We'll be right back.